My sister has hypercholesterolemia and has been told it is inherent. She was told she has to be on meds for life and that she can't do any aerobic exercise because it does something to increase the cholesterol. That makes no sense to me. Any insight? Thanks, sweetheart. Love you too. Yeah, absolutely. You know, more activity of the human body, the more you see acids. And the more you see acids, the more you see pain and swelling and eventually the deterioration of cells. So absolutely. So remember, when you have weak adrenals and you have low steroids and you have you're not filtering your lymph system well, then you're going to have cholesterol or calcium and a little bit of edema come in there. So remember, though, the three most common antacid measures you see: cholesterol, calcium, and edema. Those three things you will see there. So yeah, but remember, this is a lymph system problem, and so you're going to go after her kidneys, her adrenals, and her lymph system, and all that'll back down. Cholesterol problems aren't inherent. The weaknesses of tissue is. Cells are. So you see cellular weaknesses as the issue here, and that's going to direct you to her kidneys and adrenals. So real important here to keep her from strokes and heart attacks and things like this. The body uses, remember, cholesterol is the body's main antacid. So this concept there's good or bad cholesterol, that freaks me out that we're still living in that kind of ignorance. You know, you have to understand what cholesterol is. If someone says, well, your bad cholesterol's up, well, first shouldn't you understand what cholesterol is and what the role of it is in your body? I mean, that would be a smart thinking. And so it's an antacid. And it's all your adrenal steroids are made from cholesterol, or at least most of them, LDL, and that's anti-inflammatories. When you have pain, a medical doctor will give you a shot of cortisone or something. Pain is acid side of chemistry, and you use the base side of chemistry to fight that. Kind of like I spent years in emergency rooms, and when you come into the ER, it is acidosis, whether it's trauma or dietary related, and we hang a bag of normal saline and start cooling you down, backing down that pain and inflammation. So where do you get the cholesterol from, which you duly pointed is needed for fighting acids? Well, I mean, as far as we know, the liver is probably the seat of most of the production of cholesterols. That's why you see most statins, they always watch liver enzymes because the statins are liver-suppressing chemicals, and anytime you suppress any function, you could cause damage to cells, and so they look at your liver enzymes and alkaline phosphatases and stuff. But yeah, cholesterol is the key component of the body. I love this, your bad cholesterol, so everybody's tuned in their bad cholesterol. Bad boy, bad boy. Bad boy for doing your job. I mean, this is the ignorance that's out there. Just sickening. Since cholesterol is not in fruits and veggies, how do humans get cholesterol in their diet? Well, I could care less if you get it in your diet. You manufacture it from the liver. So I really don't look to consume it through diet, really. You might get a little in dead animals because of the use cholesterol has in the process of the, just in the lymph system still stuck in the animal. I mean, if you want to look at what animal tissue is, it's just a bunch of cells and stagnant blood and lymph. Of course, and everything is putrefactive, so what you're eating is just a whole bunch of coarse amino acids lumped together, putrefying, and dead stagnant blood and dead stagnant lymph full of acids. That's what you're eating. And this is why the statins are ridiculous, because you're suppressing your liver to stop producing cholesterol so your blood serum cholesterol looks okay. I mean, that's baby thinking. That stuff doesn't even satisfy the intellectual mind. Excuse me. So this is the thing. You have to understand that you can't suppress the liver, and just for the sake of blood serum cholesterol levels, you see, I had a lady in the other day, blood serum cholesterol levels perfect. Thick cholesterol ring. You see this thick white hazy ring here?
That's a cholesterol ring. That's thick cholesterol ring. And now you're seeing this violet hue around the outside. Now, I know we've probably addressed this, but Debbie, I'm just laying here, maybe I didn't get rid of it, but this is the only way that you can determine that there is poor circulation. When you see cholesterol plaquing, you can just about assume this pupil looks awful clean for this cholesterol ring, because generally you see a cataract forming here, and this person could have had cataract surgery already. When you see a case like this, you want to keep them on circulation formulas, particularly upper circulation, and keep them from stroking, because these people are in stroke, heart attack zone anytime. Well, this lady can stroke any day, and that's the problem. And suddenly you have a stroke, and where did that come from? My cholesterol's good. That's the bull crap of that one. Even Deepak Chopra, Dr. Wild has commented on how ridiculous the statins are. And that's true. You don't want to damage your liver because you have an acid problem and you're trying to control the blood serum levels of cholesterol, but you can't stop the plaquing of it. That's the problem. And you don't want to. You want to remedy why the body's kicking up cholesterol. First thing out the chute, weak adrenals. Why? Steroids. When your steroids are low, cholesterol-based steroids, your body's going to go to cholesterol directly. If I can't find what I need here, I'm going to find it somewhere. That's because the body's in a fight for survival. This is a fight of survival at the cellular level. And there's 100 trillion little cells there that are fighting to survive. And blood and lymph is how the body controls the consumption and elimination of the cell waste and what cell needs nutritively. And the nutrition, I've said, is easy to deal with. Just change your diet to at least a high level of raw fruits and vegetables, particularly a lot of fruits, berries, and melons. But green salads, green juices are okay. If you want to detoxify deeper, shuck the greens, shuck the vegetables. And you'll see the difference. But, finding some balance in a diet like that's important, but I highly recommend that you fix your problems first. I just found out I have cataracts. Surgery has been recommended. Does anyone have any advice on this issue? Absolutely do. Now, here's the other not so good part about this, is that cataracts are cholesterol. And if you look at this and you see that you're plaquing cholesterol in the pupil, let me tell you, you're also plaquing it in the brain. And this is important to understand, that your lymph system isn't draining well from upstairs here. So you really want to get your lymph system moving. Get your bowels cleaned up so you can drain better. Work on your neural lymphatics down the back. Get those kidneys filtering. Hit those adrenals and get them up. Because you must start moving lymph. Because now your body's using cholesterol. And when you see, guys, cholesterol being used, you immediately know your adrenal steroids are low. I don't care what they say. You're not producing adequate adrenal steroids. Well, of the people that have the strokes and the heart attacks, guess what their common weaknesses are? Kidney failure and adrenal failure. Always. Those two tied right with them. Always. So you see the CHFs, congestive heart failure, and the pulmonary edema, swollen ankles, all these things, strokes, heart attacks, all these sort of things, all linked to the same thing. The body's response to acidosis. You can use upper circulation, brain and nerve. I would, just because of what that means. Then definitely want to open up this lymph system and get this draining. You can use eye wash to help, both internally and externally, because eye wash helps to move lymph and blood. But with that said, this is a big internal lymphatic stagnation issue, and that means it's a big acidosis issue, because your next stage is looking at macular degeneration, all the other signs of detached retinas, blah, 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 because of what acids do to you. So it's just your body's trying to help you, but at the same time, it can be devastating. So get yourself opened up there. Now, this person had been to a Chinese medical practitioner recently and been told that she has low circulation, that all her organs are sluggish. I have a mild fatty liver. Well, mild fatty liver would not be poor blood circulation, it would be poor lymph
circulation. That is your lymph system. That's why it's fatty, because fats are antacids. And of course, where you see fatty deposits, guess what's there? Acids. So your lymph system isn't moving well. So this is both your kidneys, adrenals, but I can tell you your colon, you got interstitial lymphatic constipation. Fix up your colon there as well. High cholesterol. Okay, so what that's saying is, there you go. Your cholesterol's up because your acids are up. Remember, cholesterol is the body's main antacid. And of course, you're forming stones because in an acid environment, the fluids become anionic. They coagulate. They stick together like blood cells and blood and bile and cholesterol. Your question is, can a congested liver shut down other organs, making them perform slowly? No, but the same lymph system can. The same lymph system that shut down your liver can shut down the rest of your body head to toe. Remember, this is 3/4 of interstitial fluids, and what's interstitial mean? Around the cells. Spitting up a lot of mucus daily. Now, we like that? We like that. That's what you want to do, sweetheart. Mucus out the mouth, mucus out the nose, mucus out the back end, and mucus out the front end. Okay? Very important. Mucus comes out in urine, stool, nose, mouth, and if female, maybe a little where. Liver gallbladder detox, you are. I mean, if you're detoxifying, you're going to detoxify head to toe, the lymph system. You don't need to focus just on one tissue or another, because the lymph system is universal. It is the one in the whole body that you have to clean all this lymphatic system. It's head to toe. That's the problem. It's head to toe. And so this stuff has to come out all through you to restore good gland function. But also work on the colon with the stomach and bowel formulas. You can use the liver formula, but the problem's the lymph system in the liver. You can still use the liver formula, but I would do 2 lymphatics, 2 kidneys, and really get my lymph moving. Put yourself on a grape fast for 10, 20, 30 days, or a lot of fruit there.